Namaskara. I am Dr. Harihara Murthy. I am practicing in Bangalore at the Murthy ENT Center in Koramangala for about 3 decades now. Earlobe tear is a fairly common occurrence caused by the tear in the soft portion of the ear. This earlobe where people wear earrings. Earrings which are very heavy can cause a progressive weakening of the earlobe from the puncture area onwards, downwards. As a result, there can be a long tear. The suturing of the earlobe is the best way to treat it. Sometimes there can be a laceration caused by an injury when a ear ring may get snagged onto some external object, or it is pulled. Sometimes children hold things and pull it. Babies have the habit of pulling things. Even that can be sufficient force to cause a earlobe tear. The treatment again is suturing. Suturing is the treatment of choice for any earlobe tear, whatever may be the cause for it. It is best done with non-absorbable suture materials, so that in a period of a week to 10 days it is healed well, and wait for a period of at least a month and a half to 2 months for the strength of that area to be good before a new earring is placed on the earlobe.